Welcome to the Knowledge Resource Service website. At KRS, we enable access to high-quality evidence resources and provide help in using them effectively, both virtually and in person. Today we'll talk about one of the resources we provide to help you with in your evidence-informed decision-making. Lippincott Procedures is a point-of-care tool that provides evidence-based guidance on clinical procedures and skills, and is one of our courses within our Evidence at Your Fingertips series. Let's take a closer look at Lippincott Procedures. Today, by the end of the session, you should be able to locate Lippincott Procedures via the KRS website, conduct a basic search using discipline types to filter results, conduct a basic search using content types to focus results, and you should be able to locate the instructions to download the mobile app. Point-of-care resources are online reference tools for practice. The known information and evidence on a given topic is filtered and summarized. Often the content is graded and referenced so that you know where it came from and that it is considered high quality. As a clinician, educator, or manager, we know you have a lot going on in your day. The objective of point-of-care resources is to make it as easy as possible to access the evidence you need to quickly make decisions about patient care, provide care, and to learn. You can also be confident that the evidence presented is the most current available. So now that we've talked about the basics of point-of-care tools, let's move on to briefly talk about Procedures and its related product, Advisor. Advisor and Procedures are complementary products from the same vendor. They work in tandem to provide a complete picture of evidence-based information to help guide clinical practice. They do differ in what they have to offer. Advisor is focused on the what and the why, while Procedures is focused on the how. Point-of-care resources usually contain a few different types of content or documents. In Lippincott Procedures, you can access procedural information, checklists, quick lists, images, and videos. And we'll be looking at more detail of these content types shortly with a case study. So let's make this real by imagining the following clinical scenario. Your patient is a 65-year-old bedridden man with type 2 diabetes in acute care who has bacterial pneumonia. So let's hear from his care team. The nurse would like to find information on the skills needed for blood glucose monitoring, and they're looking for text and video-based information. In addition, the physical therapist would like to find information on the topic of alignment or pressure-reducing devices, including the skills required, and they're looking for text and image-based information. You can access point-of-care resources through the KRS website. If you're not already familiar with our website, there are two ways to get to it. You can do a keyword search or browse for us on the Insight webpage, or you can simply type our URL in the Internet browser, which is krs.ahs.ca. You can access Procedures via a mobile app as well, which we'll talk about later in our session. If you're looking for us on Insight, you can search for Knowledge Resource Service in the search box or browse the Teams and Departments page. So we will now go online for a brief demo. This is our website address, krs.ahs.ca. We recommend that you bookmark this site or create a desktop shortcut so that you always have quick and easy access to it. You can access Lippincott Procedures on our homepage in the Popular Resources section on the left-hand side of the page. Here is our homepage for Lippincott Procedures. You can see that we have some options available to us on the top right-hand side of the page, some of which we will talk about later in our session. For now, I will mention that you have a help option available to you with the large question mark icon and an option to return to the homepage via the house icon. There are two ways of searching in Lippincott Procedures. You can search by discipline, which allows you to browse for information using a series of menus, or you can do a general search using the query box at the top of the screen, using keyword searching. We will show you both methods of searching today. Let's try the discipline-specific search first, so we will select nursing. When you search by discipline, you have the option of focusing your search to specific practice areas, such as what we can see here, such as long-term care or oncology. You can also see how menus allow us to browse the information available. Once you have selected your specific practice area, you then have the option to further focus your search. For example, here we're going to select specimen collection and testing within the medical surgical specialty area. You'll also see that you have an option to browse by alphabet from A to Z. Bearing in mind our clinical scenario, we are looking for information on blood glucose monitoring. So once we select specimen collection and testing, we will see an option here for blood glucose monitoring. As you can see, we were able to find that information by browsing using the series of menus and submenus available to us to help focus our search. Now that we've found the information we're looking for, let's select it and take a look at it in more detail. Here is our procedure information for the topic of blood glucose monitoring. It's worth remembering that as this is a nursing discipline specific search, the information we are looking at will be more focused towards nursing staff. On the left-hand side of the page, you can see that we have access to a navigation pane. This lets us quickly move to the specific piece of procedural information that we may be interested in. You can also see that we have a navigation pane at the top, listing the various content types. You'll remember that we are looking for skills information and a video if possible. Now let's take a brief look at quick lists, which are a specific content type found in procedures. Quick lists summarizes the information you need to know in order to carry out a procedure in bullet point form. This allows you to quickly see the key points of a procedure and what you may need to do to prepare. They function quite similarly to the skills checklists, and we'll take a look at skills checklists in a bit. You have the option to print or email any of the pages you see within Lippincott Procedures, including quick lists. Now let's move on to take a look at the videos we have available for this topic. We can see that there are several to choose from. All videos found within Lippincott Procedures are short and instructional in nature. Watching them doesn't take up much of your time. Now that we've seen how you can carry out a discipline-specific search, let's take a look at how you would carry out a more general search using the search box from the home page. We are looking for pressure injuries, so we will type that in the search box. We can see that the database has returned results from across all of the disciplines by searching this way. All is the default option you have chosen for these results. You can see the various content types available containing the particular topic. In order to focus your search by discipline, you will just need to tab on to the discipline you are interested in. We will recall from our clinical scenario that the physical therapist would like to find information on the topic of alignment or pressure reducing devices. You can see that we have chosen to focus on the physical therapy discipline. We will now take a look at what is available on this topic within the discipline of physical therapy. In our clinical scenario, we are looking for skills information on alignment and pressure reducing devices. The second article looks like it may be useful to us, so we will go ahead and select it. Here we can see all the associated information for this procedure. As we've already seen the navigation menu, let us jump quickly between the listed procedure information. We can also deselect those pieces of information we are not interested in. This becomes useful if you want to print. Now let's take a look at the skills checklist to see what we need to know for this procedure. We can see that information is available for several different procedures for this topic. Let's select the skills checklist on trochanter rolls application in more detail as it looks relevant to us. Skills checklists are bullet point lists of all of the key skills that you need in order to carry out this procedure. Our physical therapist is also looking for an image on this topic. We have chosen to examine trochanter rolls in our quick list, so let's look for an image here. You'll see that images are listed as a content type for this topic. Now we'll select images from our content type menu to find this image there. We've gone ahead and selected images, and we can see that all the images are listed here. In fact, all the images you see listed here may be found within the procedural document we just came from. There is the image for trochanter roll application. That answers our physical therapy question. And as we've mentioned, a central feature of procedures is that it's an evidence-based point-of-care tool. We now move on to see where you can find the evidence used to back up the information you're seeing. You will find it within your results page at the bottom of the main article. Gray literature may also be included, as well as guidelines. Database articles that the information was referenced from are also included. Additionally, you'll find a link to a rating system taken from Evidence-Based Practice in Nursing and Healthcare, 2nd edition. Now that we've looked at how to search procedures and have taken a look at the various content types it contains, let's move on to briefly talk about the other feature available in procedures. We don't have time to explore the feature in much detail today, but we just wanted to make you aware that it's available to you. Lippincott Advisor. As we carried out our searching today, you may have noticed the tab for Lippincott Advisor. It's possible to easily and quickly move between both Procedures and Advisor using this tab. As well, it's possible to search both tools at the same time. You can always reach out to KRS staff to ask for help. Lippincott Procedures is also available as a mobile app for your Apple and Android devices. You can locate the instructions to download the Lippincott Mobile App within the Education Guide tab and then select Mobile Apps and Resources. If you have any questions, suggestions, or feedback, you can connect with us through chat or ask us a question on our website, or you can email us at krs@ahs.ca.